This is the Federal Medical Center in Jalingo, Taraba State, where all suspected cases of Lassa fever are brought in for treatment. It is a viral hemorrhagic disease caused by the Lassa virus, which is transmitted primarily through contact with the urine, saliva, or feces of infected rats, or through direct contact with the bodily fluids of an infected person. At least 20 persons are confirmed to have died from the disease in the month of January 2025 at the Federal Medical Center. Managing Director of the Federal Medical Center Jalingo, Dr. Aisha Shehu Adamu, in an interview with Arise News, says the cases of Lassa fever in the state have worsened when compared with previous years.
We are currently experiencing the Lassa fever epidemic. It usually comes on during the dry season, November, December, up to the onset of the rainy season. This year has been particularly bad for us. If I can give you an idea, from the 1st of January to date, which today is 28th of January, we have seen 19 suspected cases. Out of these, 41 were confirmed positive, and we managed 7 cases. Unfortunately, we lost 20. That's like 50% of cases. Currently, we have 9 people on admission, and then we had to refer 1 because of dialysis. We currently do not have dedicated dialysis facility for Lassa fever. You can see that this data is enormous, is worrisome, is burdensome.
Although the state government, in collaboration with the hospital management, has set up a quarantine center for those suspected to have the virus, it is still spreading on a daily basis. Dr. Adamu, while raising an alarm on the high mortality rates, blamed the high consumption of rodents as food in some communities, a major causative factor for the virus spread. On the care for patients, Dr. Adamu says the hospital has put in place measures to control the virus spread.
We, as a health facility, we prepared for the outbreak as far back as October. We had meetings. We already have a committee in place, that is the infectious disease committee. They prepared to make sure that we have all what we need to attack the disease. Staff were trained, and the training is currently ongoing on the need to prevent infection, on the need to be alert to cases of Lassa fever, so that they can be identified, isolated, and treated. As a facility, we have also been able to get some commodities that we use in terms of management of Lassa fever for barrier nursing. And also what we did for our staff, all pregnant staff were given leave to go home until the season is over.
The Director of Public Health, Taraba State, Dr. Abe Abu, says the government is intensifying efforts to sensitize people on the epidemic, noting that the Ministry of Health is closely monitoring the situation.
As we speak right now, Taraba State Government, in partnership with Nigerian Red Cross Society, are going to the 6 LGS that we have had cases of Lassa so far. We are going there, local government by local government, talking with the community, the traditional leaders, the religious leaders, so that they will also go ahead and propagate this in churches, in mosques, in town, markets, and all that. And this is a continuous thing.
According to the NCDC, in 2024, Nigeria recorded 9,685 suspected cases, 1,187 confirmed cases, and 191 deaths across 28 states and 138 local government areas. As the dry season reaches its peak, health experts advocate that better precautions are taken to prevent its rapid spread. Folashade Daramola, Arise News.